Kidney stone, also called renal calculi, nephrolithiasis, or urolithiasis, are hard deposits made of minerals and salt that form inside your kidney. Diet, excess body weight, some medical condition, and certain supplement and medication are among the many causes of kidney stones. Kidney stone can affect any part of your urinary tract from your kidney to your bladder. Often stones formed when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stone can be quite painful, but the stone usually causes no permanent damage if they are recognized in the timely fashion. Depending on your situation, you may need nothing more than to take pain medication and drink a lot of water to dissolve the stone formed. For example, if stones become logged in the urinary tract, are associated with a urinary infection or a cause complication, surgical procedure may be needed. Your doctor may recommend preventive treatment to reduce your risk of recurrent kidney stone if you are at increased risk of developing them again. A kidney stone usually will not cause symptoms until it moves around within the kidney or passes into one of the ureter. The ureter are the tubes that connect the kidney and the bladder. If a kidney becomes locked in the ureter, it may block the flow of urine and cause the kidney to swell and the ureter to span, which can be very painful. At that point, you may experience these symptoms: severe, sharp pain in the side and back below the ribs, pain that radiates to the lower abdomen and groin, pain that comes in waves and fluctuates in intensity, pain or burning sensation while urinating. Other signs and symptoms may include pink, red or brown urine, cloudy or full smelling urine, a persistent need to urinate, or urinating more often than usual, or urinating in small amounts, nausea and vomiting, fever and chills if an infection is present. It is advisable to make an appointment with your doctor if you have any signs and symptoms that worries you. Did you know there are actually types of kidney stones? Then here they are. Number 1, calcium stone. Most kidney stones are calcium stones, usually in form of calcium oxalate. Oxalate is a substance made daily by your liver or absorbed direct from your diet. Certain fruits and vegetables, as well as nuts and chocolate, have high oxalate content. Dietary factors, high dose of vitamin D, intestinal bypass surgery, and several metabolic disorders can increase the concentration of calcium or oxalate in urine. Calcium stone may also occur in form of calcium phosphate. This type of stone is more common in metabolic conditions such as renal tubular acidosis. It may also be associated with certain medication used to treat migraines or seizures such as topiramate. The second type is struvite stone. This form is response to urinary tract infection. This stone can grow quickly and become quite large, sometimes with few symptoms or little warning. Next one is uric acid stone. Uric acid stone can form in people who lose too much fluid because of chronic diarrhea or malabsorption, those who eat a high protein diet, and those with diabetes or metabolic syndrome. Certain genetic factors also may increase your risk of uric acid stones. Cystine stones. These stones form in people with hereditary disorder called cystinuria that cause the kidney to excrete too much of specific amino acid. I know you have been waiting for this, the major causes or risk factor of kidney stones. Number 1, family or personal history. If someone in your family has had kidney stone, you are more likely to develop stones. You are at increased risk of developing another. Dehydration. Not drinking enough water each day can increase your risk of kidney stone. People who live in warm, dry climate and those who sweat a lot may be at higher risk than others. Certain diet. Eating a diet that high in protein, sodium or common salt, and sugar may increase your risk of some types of kidney stone. This is especially true with a high sodium diet. Too much salt in your diet increases the amount of calcium your kidney must filter and significantly increases your risk of kidney stone. Obesity. High body mass index, the BMI, large waist size, and weight gain have been linked to an increased risk of kidney stones. Digestive diseases and surgery. Gastric bypass surgery, inflammatory bowel diseases, and chronic diarrhea can cause changes in your digestion process that affect your absorption of calcium and water, increasing the amount of stones-forming substances in your urine. Other medical conditions such as renal tubular acidosis, cystinuria, hyperparathyroidism, and repeated urinary tract infection also can increase your risk of kidney stones. Last thing I would like to share is about treatment. The treatment for kidney stone is similar in children and adults. You may be asked to drink a lot of water. Doctor try to let the stone pass without surgery. You may also get medication to help make your urine less acid. But if it is too large, or if it blocks the flow of urine, or if there is a sign of infection, it is removed with surgery. Shockwave lithotripsy is an invasive procedure that uses high energy shockwave to blast the stone into fragments that are then easily moved passed out in the urine. In uteroscopy, an endoscope is inserted through the ureter to retrieve or obliterate the stone. Rarely for very large and complicated stones, doctor will use percutaneous nephrolithotomy or nephrolithotropy. That's all I have for kidney stone. Please like and comment on the video. Don't forget to subscribe and press the bell button so that you won't miss any video posted at Health at Work. Don't forget to subscribe. Thank you for watching and stay healthy.